Hi, I'm Yoni Rosenblatt. I'm owner of True Sports Physical Therapy. The biggest challenges we face are finding the appropriate personnel to continue to offer Baltimore's best rehab. Certainly a vetting process, but one that I enjoy, as well as continuing to manage our business structure appropriately so that we can treat at a slower pace, so that we can spend 45 minutes to an hour with every patient that walks in. Those are certainly unique to our model and certainly an ongoing challenge. A physical therapist should join True Sports Physical Therapy because it's absolutely the ideal place to provide their care. So we have state-of-the-art facilities. We have an outstanding patient athletic population. And we have a business structure in which they can grow and benefit from the business they drive. It's simply unique and personally I think ideal in the physical therapy realm. Lessons that I learned from my mother and lessons that I learned from my father in running this business include, I'd say my father taught me to never be outworked. My father's the hardest worker that I know. I try to use that every day. No one's going to outwork the physical therapist at True Sports. I learned that from my father. And then the compassion and the education portion of what I do for a living certainly come from my mother, a lifelong educator. The way I got into physical therapy and chose that as my profession was really because I've been a jock my entire life. I've always been an athlete, and so I was drawn to the sports aspect of it. But also, I knew that I wouldn't have much time outside of whatever I do for a living to help people. And that's just because of my workaholic nature. And so when I fell into my science classes, I knew that I wanted to use them to help people, and I was thinking medicine versus physical therapy. And when I got to chemistry, I just couldn't wrap my head around it. I did well, but I couldn't see it, I couldn't feel it. I got to physics, I got to biomechanics, I got to anatomy, I got to strength and conditioning, and I loved it. It just kept me motivated, kept me focused, and that's what I use every day. I use anatomy, I use physics with every exercise that I prescribe, and that's really how I fell into physical therapy as a profession. Lacrosse has become a tremendous portion of what we do at True Sports Physical Therapy because of our Baltimore roots and because we're based in Baltimore. Lacrosse is the biggest thing going we have in Baltimore, and so understanding that specific sport and the needs of the different positions, the needs and the differences between the men's game and the women's game, we've really embraced at True Sports, and it's out of necessity. We were just seeing so many lacrosse players that we made it a focus of what we do. And so it's been an unbelievable experience and treat to focus on the lacrosse community, to grow into that community. I'm fascinated by lacrosse on the sports side and the physics and the biomechanics side because it takes speed, it takes size, it takes strength, but then you combine that with the fine motor skills that you need to throw and catch and pass and read a field. I think it's really unique to the sport. So we've really taken that on and cherished that and worked with some of the world's best as it pertains to lacrosse, and that's just kind of embedded in our Baltimore heritage, our home base. And then we've been lucky enough to partner with Israel Lacrosse, which has been around for about 4 years now, which is spreading the game of lacrosse throughout the state of Israel, and then seeing some of Israel's elite athletes compete on the world stage with an immense amount of success and probably more importantly, pride for the country that they're representing has been an unbelievable experience. I think the sport that provides the most injuries in Baltimore, just because this is Baltimore, is lacrosse, because more people are playing lacrosse than playing any other sport in Baltimore. And it's a contact sport. I'd say both boys and girls, men's and women's, they're both pretty much contact sports. And so that's become our bread and butter. And the way that we're setting ourselves apart from others treating such pathologies or such injuries is our collaborative care. We probably know your strength coach or your personal trainer or your team coach if you're a lacrosse player in Baltimore. And that's because we've worked with all of them. And so for an athlete to come into our practice, for us to understand the nature of their lacrosse injury, to treat it, and then get on the phone, and then shoot an email to their coach, to their trainer, to whoever it may be, and say, here's what we're working on, what are you seeing? How can we help you? And we do that with their coaches, we do that with their medical doctors, we do that with their surgeons. Physical therapists from True Sports are going into ORs across Baltimore in various hospitals to observe the surgeries, that our patients are undergoing so we can better understand the process and be humble about our place in the rehab process. We're a piece of it. The athlete is a major piece of it. So is the coach. So is the trainer. So are the parents for the adolescent. You have to understand that whole world. And I think that's what true sports does well. My vision is certainly to scale what we're doing now in one location across the entire landscape of sports rehab. This model, while unique, is sustainable. This model, while to date is really unheard of, we're certainly making it a proven model and absolutely have plans to scale it as far as we can.